This is part 3 of the skeletal system, the second part of the skeletal system notes. Um, Sorry, it's not my, here we go. I think this is where we left off, is with the femur, and really the two structures that I want you to be familiar with the femur are the greater and lesser trochanters, simply because they are attachments uh, for some of the major muscles. The greater trochanter is the attachment for some of the gluteal muscles, but they're attachment sites for tendons that connect some of the muscles to the bones. The kneecap is called the patella, um, and the patella is actually a bone that forms, that is within a tendon. It's within the tendon. It's called the quadriceps tendon. So the quadriceps tendon that connects the quadriceps to the patella, and then the patellar ligament that connects the patella to the tibia below it. So the patella is a type of sesamoid bone because sesamoid bones are bones that form within tissue. So the patella, this is the kneecap, is connected by a tendon here and then a tendon here. And the superior tendon is the quadriceps tendon that connects to the quadriceps muscles, which is actually a group of 4 muscles. The quadriceps femoris. And then this one is called the patellar ligament because it connects to the tibia or the shin bone. Okay? The tibia is the shin bone. It is the larger of the leg bones. And as we said before, the patellar ligament connects the patella to a structure called the tibial tuberosity. Tuberosities and tubercles are often projections in bones that either ligaments or tendons are attached to. The fibula is a very slender, long bone, and it runs lateral to the tibia. It does not articulate with the femur, meaning that it is not a component of the knee joint. All right, then we have the tarsals. Seems like I looked up a name for, and I can't remember the sentence, but it seems like I looked up a name for the ankle bones. But I'll just go over them for now. If I think of the sentence or if I look it up, I'll let you know somehow. But the ankle bones consist of the talus, the calcaneus, which is the heel bone, the navicular, the cuboid, and then the medial, intermediate, lateral cuneiform bones. And the only bone that articulates with the tibia and fibula to form the ankle joint is the talus. Okay, the largest tarsal bone is the calcaneus or the heel bone. And then, of course, the bones of the foot are the metatarsals, and then you have the phalanges in the toes, similar to the phalanges in the hand. And the great toe or big toe is called the hallux. And again, it just has a proximal and distal phalanx. This shows you some of the arches of the foot, but I want you to see this because of the to show you the different bones. So when we're looking at the foot, a superior view of the right foot, meaning we're looking down on it, this shows you the calcaneus, and this is the talus. This is the trochlea of the talus, which articulates with the tibia and fibula to form the ankle joint. This is the navicular bone, and then you have the cuboid bone, and then lateral, intermediate, and medial cuneiform bones. Here are your metatarsals, and then here are your phalanges. Each toe has a proximal, middle, and distal phalanges, except for the great toe or the big toe, which has just proximal and distal, just as exactly like the phalanges in the hand. All right, now we're going to move on to our last topic, which is joints or articulations. An articulation is technically a joint. Joints can be classified by their structure, their anatomy, and also by their function, like the range of motion. The range of motion is the easiest one to remember and to explain, so I'll go over that first. A synarthrosis joint is an immovable joint. Immovable means the bones are connected and they do not move at all. An amphiarthrosis is a slightly movable joint. And then our freely movable joints are diarthroses. A diarthrosis is a freely movable joint, and we will spend most of our time, the rest of the lecture, on the diarthrosis joints. But the structure of joints can also be used to classify them, and this is based on how the bones are held together. So they can be fibrous or cartilaginous joints, which both have limited movement, or they can be synovial joints. And synovial or freely movable joints are always diarthroses joints. So looking at this table, at the classification of joints, there are some examples on this table, so I like it for that reason. For the synarthroses joints, which allow for no movement between the bones at those joints, an example of a fibrous synarthrosis is a suture, the sutures that connect the skull bones. And then another fibrous synarthrosis is a gomphosis, and this is the connection between the teeth and their sockets, which are called alveoli, just like the air sacs in the lungs, and they're connected by a ligament. Then there's the cartilaginous synarthrosis, and that is technically called a synchondrosis. And an example would be epiphyseal cartilages, which you only see in people who are not fully grown. And then also between the first pair of ribs and the sternum is another example of a synchondrosis joint. Now we'll move on to our amphiarthrosis joints that allow for little movement. A fibrous amphiarthrosis joint is called a syndesmosis. An example of a syndesmosis is between the tibia and the fibula. There is a little bit of movement between the tibia and the fibula. And then a cartilaginous amphiarthrosis, a cartilaginous amphiarthrosis is a symphysis, and the pubic bones, between the pubic bones, the pubic symphysis is an example of that. And also between the vertebrae, the disc between the vertebrae, called the intervertebral disc, are symphysis joints. So a suture, again, is a synarthrosis, a fibrous synarthrosis joint. A gomphosis is another fibrous synarthrosis joint. It's just the difference is a suture that the bones are interlocked, and then in a gomphosis, the bone is inserted into a socket. And then the cartilaginous synarthrosis is a synchondrosis, and an example of that would be the epiphyseal cartilages. A syndesmosis is a fibrous amphiarthrosis joint. An example would be between the tibia and the fibula. A symphysis is a cartilaginous amphiarthrosis joint, and the pubic symphysis and the intervertebral disc are examples. And then we have our synovial joints, which are our freely movable joints, the diarthroses, and we have many of those, the hip joint, the shoulder joint, the knee joint, the elbow joint, the joints between the fingers, and we will be going over those in more detail. All right, so the synarthroses are immovable. Again, we're just going back over what we read in the table. A suture is completely immovable and interlocking, and it's fibrous. A gonthosis is fibrous, but the tooth is in a socket, bound into a socket by a ligament. That ligament actually wears away whenever children lose their baby teeth or their primary teeth. And then a syndesmosis is a cartilaginous immovable joint. I'm sorry, it's not. It's a fibrous joint. So it's also a fibrous synarthrosis joint. Let me look back at that table. Well, it says cartilaginous in the table. Yeah, I think this is a mistake because I know the suture is a fibrous joint and the gonthosis is a fibrous joint. So this is a cartilaginous joint connected to that connects the tibia to the fibula, and also in the forearm, the radius to the ulna. Cartilaginous. Sorry about that. The amphiarthroses are either synchondrosis, which is a cartilaginous amphiarthrosis, and the between the first pair of ribs and the sternum, and then also the epiphyseal cartilage. The symphysis, an example is the pubic symphysis and the intervertebral disc. Then we have our freely movable joints, which are diarthroses or synovial joints. They're called synovial joints because the membrane that surrounds these joints is called the synovial membrane. They have a wide range of motion. The ends of the bones are always covered with articular cartilages, which is technically hyaline cartilage. There is a joint capsule that surrounds the joint. And you can see that here and on the other side. That surrounds the entire joint and the bones that form the joint. And then there is a synovial membrane that is filled with synovial fluid that helps to lubricate and nourish the joint and the cartilage of the joint. There are some additional structures. This is a typical synovial joint. It is the knee joint, and it's where the femur and the tibia articulate. And you can see here in this joint the quadriceps tendon and the patellar ligament. That the patella bone is within those two structures. The meniscus or menisci in the knee are these little, these are very tough pads of cartilage that help to support. There's one on this side too. Help provide support to the joint. Fat pads cushion the joint. Bursa, you may have heard of a person having bursitis, which is inflammation of the bursa. But bursa are packets of connective tissue that contain synovial fluid, and they help reduce friction and absorb shock, along with the fat pads and the menisci. As far as types of synovial joints and types of movements, there is plane or gliding movements. Between the carpal bones is an example of that. You don't really see that, you don't really feel that, but they do. Whenever your wrist moves or your hand moves, those bones do move a little bit. They glide a little bit past each other. Then there's the movement called flexion and extension. A good example of flexion is when you do a dumbbell curl. When you flex, that's flexing your forearm, flexing at the elbow. And extension is when you just have your arm normal. You know, when you are in the anatomical position, your elbow is extended. And hyperextension is impossible in the elbow joint without doing damage, but there are some joints that you can hyperextend, but you cannot hyperextend at the elbow or the knee joint, and that means going back even beyond extension. There's abduction and adduction. Abduction is away from the body, adduction is back to